Hello students, I'm Dr. Barkha, Bhoneja, Senior Lecturer, Department of Prosthodontics, BBD College of Dental Sciences, BBD University. So we have already continued and covered the articulators requirements and classification to some extent. Let's move forward with the lecture. That is, giving you a gist of class 1 is a static registration, class 2A based on average values, class 2B based on the various theories of motion, and class 2C based on engraved records of the patient. Class 3 we had already covered takes the Facebook records. Class 3 has type A, which will take your protrusive record, but your lateral has to be calculated by a formula. Whereas class 3B, your lateral as well as the protrusive is given by the interocclusal record taken by the patients. Now moving on to class 4. Instruments in this class will accept three-dimensional dynamic registrations and utilize a phasebow transfer. So there is a phasebow transfer, there is centric, protrusive, and all the 5 records that I have previously mentioned. That is the centric, horizontal, vertical, intercondylar distance, and phasebow. So all of these are accepted by the class 4 type of an articulator. Now, the condylar parts or cams are formed by registrations engraved by the patients. Now, we are talking about class 4A, okay? Whereas the condyle path, that is the curvatures of the condyle, these are already registered or formed into the articulator, which was taken from the engravings given by the patient. Therefore, this is all. It is always it is an average type of engravings which are taken of recordings from all the patients. Instruments in this class do not allow for discriminatory capability of the condylar part. That is, it is set by the average values. In other words, the condylar pathways must be used as generated by the patients and cannot be selectively modified prior to developing the patient's occlusion. That is, now these condylar paths are already being set into the articulator, right? So the ways must be used as generated and cannot be modified. Now, there are something you can just modify it a little bit around from the patient's occlusion, but you cannot change it. The TMG instrument designed by Kenneth Swanson in 1965 is representative of this class. Moving on to class 4B. Now this is completely adjustable articulator. As you can see in the picture, there is open condylar pathway. Okay, so the pathway, the inclination, that is the horizontal registration. The protrusive bite can be registered by the pathway. As you can see, the vertical records facility is also here. The incisal table is movable. That is, your incisal tables can also be adjusted. The intercondylar distance rod is also movable, so you can change the intercondylar distance of the patient. The phasor record can also be adjusted. Now let's see the theoretical part. Instruments in this class will accept three-dimensional dynamic registrations and utilize a phasebow transfer. Okay, so all the 5 records can be taken as well as the phasebow transfer. The condylar pathways can be selectively angled and customized. Now, there are 2 things in condylar pathways, that it can be angled according to the patient. Now, how will you angle the condylar path? These condylar pathway values can be angled by taking a protrusive record of the patient. When you bite, the patient bite in protrusive and the bite is kept and this registration is transferred to the articulator. You'll get an angle of condylar guidance to some extent. So this angle is then transferred onto the articulator. And the other thing is it can be customized. Now the path of condyle is not in a single line. It is in a curvature which is going down. Now, this curvature can also be customized in these articulator, whereas in class 4B, this curvature was already present as based on the average values which was gathered by the engraved records. Now, here you can customize it as well. All articulators in this class are Archon instruments. Archon, as I've already told you, is articulating condyle. That is, the condyle element is present in the lower member, okay, and the condylar pathway is present in the upper. In this class are Archon instruments with adjustable intercondylar distance. Now, every patient doesn't have an same intercondylar distance. All the other articulators were based on the average intercondylar distance. Now, in this, you can measure the intercondylar distance. How will you measure that into the patient's mouth? There is a phase bow which is called as a kinematic phase bow. Now, this type of kinematic phase bow, it not only records the center of the condyle, but it also records the distance between the two condyles. So, with that recordings, you can adjust the intercondylar distances. The condylar housings can be adjusted in the horizontal, sagittal, and frontal plane. Now, this condylar housing, that is the condyle, which is present into the fossa. Okay, as you can see, it can move forward, it can move side to side, and it can rotate also. So, this three-dimensional registration of the condyle into the articulating fossa. Now, this can be adjusted into this articulator. Each has a Bennett guide adjustments. Now, if your condyle is moving forward in anterior plane and moving side to side, okay. Now, this side to side movement of the condyle into the articulating fossa is the Bennett guide adjustment. They all accept arbitrary or hinge axis phase bow transfers. Okay, so the hinge axis phase bow transfer is the kinematic phase bow that I was talking about, and there is another type of phase bow which is called as an arbitrary phase bow. So both this articulator accepts both the kind of phase bow transfers, and they are often referred to as gnathological instruments. Gnathologic matlab, it means that gnatho means there are all the tissues and all the structures like the muscles of mastications are, when your instrument is in harmony with all of these structures, it is called as a gnathologic instruments. And gnathology is study of all of these tissues of the mouth because of their full adjustability. Now, based on the theories of occlusion, we have already discussed this, that their Bonneville's triangle theory. I will just read it out that there is an equilateral triangle which is formed between the two condyles and the midpoint of the lower central incisor. This equilateral triangle is called as a Bonneville's theory of occlusion, which states that the lower teeth move in relation to the upper teeth in relation with this of the triangle. So the Bonneville theory of occlusion proposed that the teeth move in relationship to each other as guided by the condylar controls and the incisal point, and there was a 4-inch distance between the condyles and between each condyle and the incisor point. This theory was known as theory of equilateral triangle. The articulated design was called by Bonneville, who allows lateral movements only. The conical theory of occlusion. What does the conical theory of occlusion says? That the lower teeth move over the surface of the upper teeth as over surface of a cone. Can you see the lower teeth moving in relation to the upper teeth? They move in the surface of a cone which is tilted at 45 degree to the occlusion plane. Now the articulator which is formed based on this conical theory is by the R.E. Hall, which confirms this theory. The other last theory is the spherical theory of occlusion by G.C. Monson. As stated before in the lectures, that the lower teeth moving in the surface of the upper teeth as over the surface of the sphere with a diameter of 8 inches. I'm so sorry, with its center at glabella. The center of the sphere was located in the region of the glabella, and the surface of the sphere passed through the glenoid fossa along the centric with the articulating eminences. The maxillomandibular instrument and the Hagman balancer follow this theory. Okay. That is for today. We will move on to the other part of the lecture in the next lecture. Thank you.